everyone. I'm Kelly Madey, and I work with Weatherby Healthcare. And today I'm so excited to have Dr. Nicholas Kusnezov here with us. He is a board certified orthopedic surgeon. He also has a decorated career in the U.S. military and actively engages in graduate medical education and clinical research. Dr. Kusnezov, thank you so much for joining us today.
Thank you, Kelly. Happy to be here.
Another great thing that you do is you bring your expertise to our Weatherby Healthcare blog with regular articles. And today we're going to talk about one of those posts. We're going to discuss how to be the best doctor people have ever worked with. Now, in your post, you talk about the 3 A's. Can you tell us what those 3 A's are and why they are so important?
Sure. Thanks, Kelly. So the 3 A's are affability, availability, and ability. And I think that these have long been upheld as the pillars of medicine and are sometimes dismissed as platitudes. And I was first introduced to these in my medical training, but I believe that these directly translate into the pillars of successful medical practice. So these components, I think, are independently important toward establishing yourself as a reliable, capable, and really indispensable member of your medical community and of the medical field at large. In other words, successfully emulating these characteristics in your practice will really translate, I believe, into a successful practice and into really providing the best possible patient care.
Great. And now when we talk about the first A, affability, what are some examples of being affable?
Sure. And I think that some of affability is inherent, but affability essentially entails being good-natured, friendly, and approachable in the medical field. And I think that this really goes a long way, as I mentioned in my article, in an often stressful medical environment. As one example, as a physician, you'll be continually contacted and consulted by physicians, nurses, support staff, and administration. And these individuals are really looking to you for your expertise and your guidance. So affability can really foster strong working relationships in this setting, not only providing for efficient and optimal patient care, but for a strong referral base for you and your practice. So conversely, being unresponsive and unapproachable to your colleagues fosters an environment, more of avoidance, intimidation, and sometimes resent, where many may go out of their way to ultimately avoiding dealing with such a person. And this is, detrimental to your reputation, your practice, and most importantly, to patient care. Another example would be dealing with patients and their families. And this is really a critical aspect of doctoring. Now, you have to remember that while this may just be another day at work for you as a medical professional, many of these patients you're seeing may be experiencing hardship and sometimes one of the worst times of their lives. So having tact, patience, and really being understanding of this, especially when evaluating patients, discussing often complex medical management with them and their families, and counseling them, that really goes a long way toward fostering trust in you as a medical professional as well as in the healthcare system.
Yep, so all about that kindness there. Now, you also talk about your next day, which is availability and being there. So talk about how being available is beneficial for both your patients and your colleagues.
Sure. So the medical field is, can really be boiled down into a complex network of physicians of various specialties, nurses, and support staff, which all work together to care for patients. And in order to function efficiently, the components of this network really have to communicate and integrate effectively. So being available for consultation and for interaction with other medical professionals, nursing, and support staff really facilitates efficient function of this network and really, as a result, maximizes patient care. You have to remember that you're an integral part of component of this network, and that having a unique expertise and experience really leaves it up to you to effectively convey this to your colleagues and your patients. Also, while you as a physician may have many patients, from a patient's perspective, you might be one of a few or potentially their only physician. Therefore, making sure that you are available to adequately prepare for and address patients' concerns and questions regarding management is really paramount toward fostering, as I said earlier, the trust and facilitating the best doctor-patient relationship. Personally, I go above and beyond to make myself available to my patients, regardless of whether I have scheduled appointments or I'm even in clinic. And what I found is that really making myself available like this ultimately mitigates avoidable problems and promotes trust. And trust is really essential to patient care, because if patients trust you.
Fantastic. So we've talked about being affable, being available, and now we're going to talk about ability. So why does ability matter more than just being a trained physician, especially if you're working a locum tenens assignment?
Sure. So, on some level, we're all able, or we wouldn't have progressed this far in our career. But in practice, you'll really find there's a distribution of types and levels of ability. And as a locums physician, your reputation is often a reflection of your ability, be it the ability to document well or perform surgeries well or expediently. You'll be presented with a variety of jobs through locums companies with a gamut of job descriptions, and the expectations at each facility will differ even further than that. And in order to demonstrate your best ability, it's really paramount to represent yourself well but accurately. For instance, if you aren't trained, experienced, or comfortable performing certain procedures or managing patients with beyond a given degree of complexity, don't overcommit to it. Be upfront and honest about it, because not only is it detrimental to your reputation, but it's detrimental to patient care. You really need the right tool for the right job. So furthermore, because locum assignments are often temporary positions, complacency is also unfortunately a little more common. And you as a locum physician might think, why would I care about ensuring patient follow-up, or why would I care about documenting if I don't get paid any differently, or I'm never going to be here again? There may be no tangible direct incentive to giving your absolute best. However, I would urge you to shine, if not for the sole reason of giving patients the best possible care, at least for your future professional practice. Now, as a locum physician, you'll develop a reputation quickly, and it'll follow you beyond locums and through your professional career. Medicine is very interconnected, and I'll tell you from my personal experience, having done this for a number of years now, that these habits of affability, availability, and demonstrating your ability really set you apart in medicine and really will provide for you being the best doctor that people have worked with.
Well, I can't thank you enough, Dr. Kuznetsov, for sharing with us today those insights into the 3 A's, those pillars to make you the best doctor people have ever worked with. We can't thank you enough.
Absolutely. Thank you so much for having me, Kelly.